Fadi, why do we have a bespoke aligner system?
The underpinning of this system is the collaboration of 2 or 3 serious disciplines that we had currently been using, the ability to work with very skilled orthodontists in planning in each case, the intrinsic ability to work with dental monitoring, DM, very closely, and have that all on the one platform. For me, that was the absolute non-negotiable closer.
What do you mean by you work on your aligners with orthodontists?
Well, with these new bespoke aligners, we have access to amazing, talented orthodontists that work in planning our cases. Obviously, they're co-planned. These orthodontists are very, very experienced in aligner therapy. To be able to verify and have case discussions to get the best and absolute final solution for our patients, I think is priceless.
So is it not the norm that all aligners are planned by orthodontists?
No, there's many services out there, but most aligners are not. Usually they're trained technicians. The dentist will put in their prescription, and according to the dentist's knowledge and understanding of aligners, they will get whatever they request back. With our system, it's always a discussion with a panel of orthodontists, which for me has elevated the level of orthodontics we provide. And we can see that in how quickly the cases are finishing. We can see that in the limited number or reduction in the number of aligners. Look, amongst other reasons why this is happening, but yeah, it's clearly when you have a collaboration of several minds, you will always get a better outcome. And that's in any profession or in any particular modality of treatment.
Why use dental monitoring with your aligners?
I mean, dental monitoring, I've been engaged with dental monitoring and been a speaker for them for many years, but really, dental monitoring is probably, without a doubt, one of the greatest AI achievements or general inventions for orthodontics. The ability to monitor our patients, the ability to see how they're tracking was the early the early concept. But since then, with the improvements of billions of images and cases, not only are we able to see how the patients are tracking, we're able to predict remotely the final outcome. We're able to assist remotely and generate new aligner systems, and I will sort of go into that.
How do you generate new aligners from dental?
Well, it's a patented technology. So once we start with our original records, and if the patients keep taking the special scans, as they say, with a special scan box, from there, without the patients even coming back, we're able to change, if we need to, and adjust the aligner system if there's certain teeth that might not be tracking. And without the patients actually having to come back in, we can design a new set of aligners through what they call a smart system. It's a smart STL, but let's call it a smart aligner system that is able to pivot and generate a new set of aligners that is on track with the final desired outcome.
So what does that mean for me as a patient?
It's amazing for patients because patients will have treatment or not even realise if there's any deviations within the treatment. It'll be a seamless, real-time delivery of continuously active aligners that are making sure that the patient's treatment's on track. So this is really an incredible step forward in just getting consistent and deliverable results within the time frame discussed.
It doesn't add to my treatment, it keeps it within a similar time frame.
Yes, definitely. Think of it this way. If there's certain treatments that go off course, at what point do we realise they've gone off course? Even with monitoring, patients still had to come back, we had to confirm, and then if we had to do a new set of aligners, and everybody's done many refinements and patients understand refinements, this takes time. By the time the patient comes in, you can schedule an appointment that suits both the patient and yourself, and from there you will send off for a refinement, so you're in a holding pattern until that happens. The best that you can do is 3-4 weeks by the time that happens. With this scenario, this can be done within 10 days without anyone being inconvenienced. So that's pretty amazing. Just go to our Insta page and see all those beautiful cases you like, and all of them have had pre-cosmetic alignment, because if you align the teeth in the ideal position, you're already 80% of the way. Then all your restorative has to do, it's just a thin shell to deal with the discoloration, the slight design change, the slight sizing changes. By trying to do that all restoratively, you're going to get bulky enamel, bulky ceramic, not aesthetic designs and shapes. When the patients look up, you're going to see different sizing. But when everything's aligned, you're going to get beautiful, even, thin, delicate ceramics, especially when we're talking about teeth that will need veneers and so forth afterwards.